Postpartum depression and anxiety are common and treatable conditions that affect many new mothers. They can cause symptoms such as sadness, worry, irritability, difficulty bonding with the baby, and trouble sleeping. If you are experiencing these symptoms, you are not alone and you are not a bad mother. There are ways to cope with postpartum depression and anxiety and get the help you need. Some of the coping strategies that may help you are: 1. Make time for yourself. Even if it is just a few minutes a day, doing something that makes you happy or relaxed can help you recharge and feel more positive. You can read a book, listen to music, meditate, exercise, or anything else that brings you joy. 2. Ask for and accept help. You don't have to do everything by yourself. Reach out to your partner, family, friends, or neighbors for support. They can help you with household chores, childcare, errands, or just lend an ear. You can also join a support group for new mothers who are going through similar challenges. 3. Seek professional help. If your symptoms are interfering with your daily functioning or lasting longer than 2 weeks, you may have postpartum depression or anxiety that requires treatment. You can talk to your doctor, midwife, or nurse about your options. They may refer you to a therapist who can provide counseling or cognitive behavioral therapy, CBT, which is a type of therapy that helps you identify and change negative thoughts and behaviors. They may also prescribe medication if needed. 4. Be kind to yourself. Don't blame yourself or feel guilty for having postpartum depression or anxiety. It is not your fault, and it does not mean you are weak or inadequate. It is a medical condition that can affect anyone, and it is not a reflection of your parenting skills. Try to avoid comparing yourself to others or setting unrealistic expectations for yourself. Remember that you are doing the best you can and that you deserve love and compassion. I hope these tips are helpful for you. See you on next video.